Magnilife leg and back pain relief cream. Tramadol and Vicodin are prescription painkillers. Both contain opioid medications, and the benefits, risks and side effects vary slightly with each. Knowing the similarities and differences between these drugs may help people decide which is best for them. Doctors prescribe Tramadol and Vicodin for high levels of pain that over-the-counter (OTC) drugs cannot help, such as pain from an accident or medical procedures, such as surgery. Anyone choosing between Tramadol and Vicodin should consider the differences in benefits, side effects, and risks. Tramadol acts in two ways in the body. Firstly, it acts on the pain receptors in the brain to stop the body from feeling pain. Secondly, Tramadol works similarly to an antidepressant by maintaining levels of feel-good chemicals, such as serotonin and norepinephrine, in the brain. A doctor will prescribe the drug in dosages appropriate to a person's level of pain. Typically, doctors will want to prescribe the lowest possible dose. Tramadol helps relieve moderate to severe levels of short-term or chronic pain. The drug may work better for nerve pain. Vicodin benefits. Vicodin is a combination of the drugs hydrocodone and acetaminophen. Acetaminophen is a pain relief medication found in OTC drugs and hydrocodone is a prescription pain relief medicine. According to a study posted to the Journal of Pain Research, doctors prescribe Vicodin more often than any other opioid medicine in the United States. Vicodin offers pain relief to many people experiencing moderate to severe pain. Vicodin may also be an option for people who cannot take drugs, such as morphine or oxycodone. Vicodin is available in tablet and liquid form, and the dosage a doctor prescribes depends on the level of pain the person feels. Side effects of Tramadol. Side effects of Tramadol include congestion, a headache, flushing of the face, a sore throat, weakness, itchy skin, seizures, dizziness, nausea, vomiting, loss of appetite, constipation. Some people may experience an altered state of consciousness, making it dangerous to drive or operate machinery. Many side effects resolve in a few days, but others may remain. Other risks: some people may have a severe allergic reaction to Tramadol. Anyone who experiences a swelling or itchy tongue, throat, or face should stop taking the drug and seek immediate medical attention. Side effects of Vicodin. Side effects of Vicodin include drowsiness, feeling dizzy or lightheaded, altered state of consciousness that may make basic functioning difficult, nausea, vomiting, constipation, low blood pressure. Severe allergic reactions are possible with Vicodin. Anyone experiencing signs of an allergic reaction, such as swelling or itching in the throat, face, and mouth, should seek emergency medical care. Risks of Vicodin. People taking Vicodin may be at risk of becoming dependent on the drug. Taking high or prolonged doses of pain relievers that contain acetaminophen, such as Vicodin, may put a person at risk of liver damage. Avoid taking any other drugs containing acetaminophen, as an overdose can be harmful or fatal at high doses. Interactions for Vicodin. A person should avoid alcohol when taking Vicodin or Tramadol. Vicodin may interact with other drugs and cause unwanted, potentially dangerous interactions. Drugs that may interact with Vicodin include alcohol or phenedrine, azolastine, eluxetylene, thalidomide, idelalisib, conivaptan, butorphanol, buprenorphine. The liver breaks down both hydrocodone and acetaminophen. Taking these drugs with others that affect the liver may lead to a buildup and toxicity, which could cause severe symptoms or potential liver failure. This list is not comprehensive, and other drugs may interact with Vicodin. People should always tell their doctor about all the drugs they are taking before using Vicodin. Anyone taking Vicodin should take care to read their other drug labels to check for possible interactions. Interactions for Tramadol. Interactions for Tramadol are similar to Vicodin, with some distinctions. Drugs that may interact with Tramadol include alcohol or phenedrine, azolastine, eluxetylene, thalidomide, butorphanol, buprenorphine, carbamazepine, nalbuphine. Other drugs may interact with Tramadol, and anyone considering taking Tramadol for pain relief must let their doctor know about all the medications they are taking.